Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada. Hello, everyone, and thank you for joining us for another episode of the Action on Pain podcast. We're super excited to be recording yet another amazing episode. I'm Jennifer Daly-Cyr, and joining me today is Keith Meldrum. And unfortunately, our third co-host, Virginia McIntyre, is not available to join us today. However, we will miss her, and we're certainly looking forward to having this discussion today. So over to you, Keith.
Great. Yeah, thanks. It's always a pleasure to be back in the studio with you again, Jen. And yeah, we're definitely missing Virginia. For those who might be listening for the first time, I'm the West Coast representative of this little podcast. So I'm joining everybody from Kelowna, British Columbia today. So always a pleasure to be here and get a chance to talk to everybody. With that, I get the honor, and it truly is an honor for me to introduce today's guest. We're just very, very pleased that she's taken time out of her incredible busy schedule to join us. So today, we're joined by Dr. Jennifer Stinson. Dr. Stinson is the Mary Jo Hatta Nursing Chair in Child Health and a senior scientist in the Child Health Evaluation Sciences Research Program at the Hospital for Sick Children in Toronto, commonly known as SickKids. She is also a nurse practitioner in the chronic pain program in the Department of Anesthesia and Pain Medicine at SickKids, and a professor in the Lawrence S. Bloomberg Faculty of Nursing, Department of Pediatric Anesthesia and Pain Medicine, and the Institute of Health Policy, Management, and Evaluation at the University of Toronto. Her program of research focuses on equitable co-design and development of digital therapeutics for assessment and management of pain in youth with chronic conditions, as well as development of patient-reported outcome measures. Dr. Stinson also focuses on interprofessional pain education, which is demonstrated in her leadership of innovative training programs which provide virtual mentorship to community healthcare providers on the management of complex pediatric patients. Dr. Stinson, it is our absolute pleasure to have you join us today.
Thank you, Keith and Jen. Happy to be here.
Oh my gosh. And I'd also like to mention that Dr. Stinson has received the Peter Gilligan Canada Gairdner Momentum Award, as well as the Order of Merit Award as nurse practitioner from the Canadian Nurses Association. I mean, my goodness, Dr. Stinson, your qualifications are such a gift to the world. Can you tell us a little bit about your thoughts around the action plan for pain in Canada? And specifically, I think you've mentioned the goal number 2, which is to improve access to timely, equitable, and person-centered care. Would you like to share your thoughts on that?
Yeah, so it's my program of research is really centered around this action plan, which is trying to make sure that we have equitable approaches to populations that may be even disproportionately impacted. And so this also aligns with some work that we did when Katie Burney was a postdoc in my lab, where we asked patients, clinicians, and their family members what were the top research priorities for pediatric pain. And what came out loud and clear was that we needed to improve access and delivery to evidence-based treatments and better coordinate care for kids with chronic pain to reduce the disparities that we know happen for visible minorities, Indigenous populations that are underrepresented in the pediatric pain clinics. So some of the things that we're doing in our lab is I have a PhD student who's a physiotherapist in the chronic pain clinic at SickKids. And she just created and validated a new tool called the Pediatric Pain Scan. And this tool helps people, clinicians, screen for 2 conditions that are really rare, but are really hard to treat. And that's neuropathic pain and complex regional pain syndrome. So she's developed this tool using a phased approach and validated it at SickKids, Boston Children's, and Stanford. And now it's freely available. And the goal is that this is going to be used by like primary care providers as well as specialists to screen for these patients that may have these conditions, because we know that if we can get them into our pain clinics quicker, their outcomes will be improved. So that's just one example of developing tools, screening tools to help ensure people get the right care at the right time.
That's amazing. I can't even begin to imagine what impact that tool is going to have. And you talk about, you're saying that it's also going to be broadly available. So tell us about that.
Yeah, so Julia is just doing some work now to try to educate people about this. So one of the things we have at SickKids is we have an online pediatric pain curriculum that provides education to people that are just coming out in practice across various different disciplines. And so she's going to embed it in there so that people are aware of this condition. And it's also been talked about a couple of times in Pediatric Project Echo, which
Mhm.
I think, Keith, you mentioned at the beginning a little bit, that I helped bring this project to SickKids, where really we know that most people that have chronic pain are living in the community with this condition and often don't have access to specialized care providers. And so it's their family doctors or
Mhm.
physiotherapists or nurse practitioners that are caring for them. And Project Echo helps to provide those practitioners with the knowledge and skills to help them feel more comfortable
Mm,
caring for those patients. So she's embedding it in programs like that so that we can educate patients and families. And I think podcasts like this, which will reach patients and families, they're the other people that need to be made aware of these tools, right?
that's fantastic. And we can certainly highlight that as we promote this episode as well.
Absolutely. I think most of us would have a soft spot for pediatric pain because
Mm,
nobody likes pain. Nobody likes to see children in pain. So I'm just wondering, and I might be projecting my own thoughts or biases, but
Mhm.
with children, is some of the challenge behind that with connecting with them is, I mean, we know there's a stigma and a dismissiveness to chronic
Yeah.
pain in general. Is it more so with children just because maybe it's harder to connect with them, or what are some of the challenges more with children that to be able to effectively validate and treat their pain?
Yeah, that's a really good point, Keith. I think there's a lot of misconceptions about pain in children.
Mhm,
People don't think children get chronic pain. They think it's something that adults only get.
mhm,
They think that kids, like infants' nervous systems, are too underdeveloped for them to feel pain. But we know that by 28 weeks, they're fully developed enough that they can perceive pain.
mm,
I think it's also creating tools that allow children to communicate in a way that's meaningful to them about their pain, right? So that's why we have created a lot of tools to help children communicate about their pain, whether it's apps like we created Pain Squad, which is an app that's really available for young people with cancer so that they can track their pain, whether it's in the hospital or in the home setting, and then share that information with their providers. So I think it's important to have tools that children can use and that they like using to report and tell us about their pain. And as you mentioned, there's a lot of stigma, right? A lot of
mhm,
people that we see will have seen numerous different practitioners, and they're giving the patients the impression that the pain is all in their head, or that and then they're not being believed. And then there's special groups like young people with sickle cell, for example, that have extra stigma of going to the emergency department, and they know which medications work for them.
mhm.
And then when they ask for it, they're labeled as drug seeking, right?
Right.
Whereas a person with asthma who said, "This is the puffer that I need for my asthma," would never be labeled in such a way, right?
Yeah.
So I think we have a lot to do to reduce that stigma.
Mhm,
I really appreciate how you drew those comparisons between, pain and needing pain medication versus perhaps a better known or better understood condition of pain, in children, and being able to explain that. And I'm thinking back, you're reminding me to one of my sons had brain surgery when he was in his early teens. And that was, 15, 20 years ago almost. And, it was viewed to be, okay, you've had the surgeries, move on with life. And yet he's lived with that pain all of his life. And
Mhm.
it wasn't that level of, well, education on my part as a parent. The things have changed that much now. And so I'm just delighted to hear this, because for all the children coming through the system, coming through Sick Kids, coming through,
mhm.
the by using these tools available and the physicians using the tools. I just can't say enough positive things about it. So thank you.
That's great.
And I've got sort of a little bit of a connection. And I mean, technically, I guess I was considered pediatric when I had my car accident. I was 16. So I technically fell in that. But, dealt with a little bit of that sort of stigma of, it's all in your head.
Yeah.
But, and just to sort of plug some work that I did, so this is very shameless, but about 4 years ago, I was honored to co-author an article with Dr. Melanie Knoll and a couple of others out of Stanford and Harvard. And we talked about pediatric pain as a precursor to toxic stress. And it was really that if it's untreated, just the long-term effects that has on children. So I think it's just fantastic what you and your team are doing, which is to shine this light on this. Because I often think children are they're just not heard, and they're left to suffer without meaningful and effective care. So
Yeah.
A great point. And I think you've touched on this certainly a little bit already, but I just like to probe a little bit more in terms of if we look at, say, goal number 3 out of the action plan deals with increasing awareness, education, and specialized training for pain. Can you elaborate a little bit more on that? And I think about, as you said earlier, enlightening the audience that will be listening to this so that there can be additional information available to them as well.
Yeah, for sure. So again, that was one of the top research priorities that patients with chronic pain, pediatric patients, and the clinicians said was they wanted effective strategies to increase the training of healthcare providers so they have knowledge so that they're able to recognize pain, that they don't have these misbeliefs and attitudes, right? And that they have the skills to be able to communicate effectively with young people and their families. So some of the things that we're doing is I mentioned Pediatric Project Echo. So that is really funded by the Ministry of Health in Ontario, but we have people from all over the world joining that. So it's great to see what's happening in that space. And one of the cool things that we're doing, we have a digital specialist on the Project Echo team, and he's created a generative AI persona of a young person with chronic pain. And the clinician interviews that patient, and they're teaching the clinician how to use techniques such as motivational interviewing. And then that persona will then provide feedback in real time to the clinician on how they're doing. So I think cool things like that of trying to train people to use techniques like motivational interviewing to engage people, I think is really important. As I mentioned, we have the online pediatric pain curriculum. We have approximately 15 modules. And the cool thing about this is that we've involved people with lived experience in every single module as a co-author. So they help the clinicians develop the case studies, they review the material. And so I think that's really innovative. And then I think the last thing that we're doing to educate people is for the past 20 years, we've had a training program in Canada called Pain and Child Health Training Program. This was initially funded by CIHR. And then in the last approximately 7 years, it's been housed in the Pain Center at SickKids with support from the Chronic Pain Network. But this training program has trained over 400 trainees in 12 different countries, mainly Canada. So Canada actually has a reputation for having the largest number of pediatric pain researchers, which is amazing.
Oh, wow.
I don't think I knew that.
And I think it's really due to this training program. Yeah.
That's incredible.
That is incredible.
And clearly leading the charge globally as well.
Yes.
Trying to help.
we do hear, I've heard, when I work with others from like around the world, they talk about, they hold Canada up as a bit of a sort of a beacon of like how we're, quote, doing it right. And yeah, I don't think I really fully understood that the first time I heard it, but the more that I talk to others internationally, and then people like yourselves and others that we interview here, Canada really is doing some amazing things as a leader in pain. And pediatric pain, just can't say enough about how important it is. So but the question that I have is, and this is just your opinion, of course, you talk about educating clinicians. And like you said, often that all-important family physician or maybe somebody like a PT will be kind of that front line or first point of contact into it. Are you finding these healthcare providers are very open to or actively seeking this kind of education and saying, yes, please give me these tools?
I think it goes both ways. I think sometimes they are seeking out these because Project Echo is like these clinicians are busy. It's during the work days. They have to take time out of their schedule. So it has to be important for them. But I think through the training of healthcare professionals, pain is being seen as an important, it goes across every condition. It's a condition in and of itself, right?
Right.
And so it's just everyone has a role to play in pain. So I think it's important. So I think it comes from the training bodies that say that pain is important. It needs to be in the curriculum, as well as providers are seeing these really complex patients in their
Hmm.
practices and are struggling because they don't have the knowledge and skills to deal with them, right? And there's not a lot of places they can refer them to, or if they do, for
Hmm.
children and adults, the wait times, especially since the pandemic, are really
Mm.
long, right?
Right.
So they're sort of having these drivers from outside, but also from the patients that they're seeing, the need to have that additional training and education to help them feel confident in caring for these patients.
And you said the word I think is so important. And I try and, look at this from the perspective of the healthcare provider. It's that confidence, right? And,
Hmm.
and I'm a huge proponent and supporter of family medicine. I think it's incredible because it's often your first stop when you have an issue.
Hmm.
And when that clinician doesn't have that confidence or training and they're introduced with this complex patient, like what do they do? And I think often there's a bit of a shutdown or they're like, I don't know what to do. And how do I help them?
Yeah. And I think that doesn't make you feel good as a clinician, right? Not being able to
Right.
help your patients. So,
Why they go into medicine,
yeah,
right?
that's why
Yeah.
they went to the practice. So, I
Yeah.
don't think they mean to be dismissive. I just
No.
think they just obviously really don't have the knowledge and skills to be able to be diagnosing and then caring for these patients. And then we don't have enough tertiary care programs, right, to deal with all the
Mhm.
patients. And I don't think all the patients need to go to tertiary care, right? I think primary care physicians and nurse practitioners and PTs can care for a lot of these patients in primary care, and that's where they should be cared for, right? So it's all about upskilling them with the knowledge and skills and confidence to be able to do that.
That's such a great point in terms of zeroing in on that. And I'm thinking about one thing that's niggling is I'd love to understand more. And this is for our audience as well, understand more about you as a nurse practitioner and how you, like that role, is affecting
Mhm.
change within that healthcare system.
Mhm.
Yeah, yeah. So obviously, I've been a nurse my entire career. I've been at SickKids my entire life, and about it's got to be almost 25 years ago that we started. Myself and Dr. Brown started the pain clinic at SickKids.
Mm.
And I think having roles like nurse practitioner roles, whether they're in primary care or in acute care settings, we can provide a higher level of care, right? Like we can diagnose, we can treat,
Mhm.
but we're part of at least I am in my practice, part of an interdisciplinary team, right? Where we have anesthesiologists, we have nurses, nurse practitioners, we have psychologists, OTs, PTs, social workers, and everyone has a role to play, right? In that patient's care. And it's just finding the right provider for that patient for their needs.
Mhm.
So, what I do in my role at Sick Kids was we'd be assigned a caseload of patients and we would follow them in terms of their medical management, their medications, coordinating things with school, if they had other caseworkers and things like that. So, we were kind of, I would say, we're kind of like the glue in the systems, the coordinators of care, so to speak. So, but yeah, I think everyone has an important role to play, all the
Yeah.
different disciplines, right?
Yeah. Yeah. That's fascinating. And hopefully that will grow as a role across all health systems because of that glue component
Hmm.
that you're talking about in such a critical role. You mentioned something a couple of times around wait times and how the impact of the pandemic and so on. And something that, I'm aware of wait times. I mean, I was a part of that for some time. It took me a year and a half to get into a pain clinic. There's two things. One is the patient is probably different after several months of waiting. To your earlier point around they need to get in there as soon as possible to be able to get the treatment they need. And so if they don't get that earlier treatment, then clearly has some form of impact on the individual. And also my own sort of circumstance was I was waiting to be fixed when I went to the pain clinic. And so I waited that. I mean, I had interventions along the way, but there was a certain niggly piece of me at the back of my mind that was going, okay, once I get there, it's going to solve everything for me. And so there's that level of expectation, and that's a bit dramatic at the way I explained it, but nonetheless, it was
Mhm.
nonetheless a bit of it was
Mhm.
an expectation to some level. But what's your impression in terms of like what impact that waiting time has, or are you able to speak to that?
Yeah, so I think, sitting on a wait list is obviously not fun, right? For
Mhm.
for the
Hmm.
patients and families, and they just want something that's going to help, right? Like,
Yeah.
and I think
Hmm.
the unfortunate thing is everyone's looking for a magic bullet,
Mhm.
and in chronic pain, we don't have that magic bullet yet.
Yep.
So
Hmm.
I think we have to try to help people have realistic expectations that chronic pain is a complex problem. There's not one solution that's going to fix it for everyone, right? And it usually needs a multimodal, so it needs medications if that's appropriate, but physical therapies, psychological therapies, and then self management, right? And so
Hmm.
one of the things we did, as you guys know, during the pandemic, Patricia Poulin and my group developed the Power Over Pain portal
Yes.
Fabulous.
for adults and young people. And we're just wrapping up 2 studies right now. One that's targeting people that are on the wait list. So providing them with evidence-based solutions in a one-stop shop that's available in English and French. There's resources for young people, some resources for parents, and there's embedded programs in there like our I Can Cope app, Tanya Palermo's web map, which are evidence-based self-management programs. So I think there's a lot of things people can do. And I think a
Mhm.
lot of young people are actually saying, I'm not looking for a medication. Like, I want things that I can do. They want to be
Hmm.
empowered, right? And so I think power over pain is one sort of aspect that can be helpful for people that are on wait lists. And I think one of the things that you sort of mentioned is we see a lot of people that come to the clinic that have diagnostic uncertainty, right? So they
Mhm.
come to the clinic
Yes.
and we'll say, well, we think you have X, Y, Z. And they still will say, well, I'm not sure about that. I still think something's going on. And they want like an MRI or whatever, right? And I think until we as clinicians try to address that, so we actually assess that. We have a registry that we provide to all patients. We've been doing this for about 8 years, and this is happening at all the pediatric clinics in Canada. We've developed a national registry, but we ask about diagnostic certainty. So do you believe that you have a diagnosis? Do you think that
Yes.
there's something that the doctors and other healthcare professionals have missed? So we're asking
Hmm.
those questions so we can probe about that, because we
Right.
find that until you address that, patients are not willing to move on to do therapies or engage in them in a meaningful way. Like, we call it sort of readiness to engage with treatment until you kind of address that, right? And I think it happens with adults as well. So.
I would suspect.
Yeah.
Yeah, definitely.
And
Yeah.
I think,
Mm.
as we get close to the end of our time with you, Dr.
Mhm.
Stinson, I think that's a great way to kind of come to a close. And I just want to go back to something you said earlier, which is, not all patients might need, a pain clinic. And when you get that early sort of interventions with education and knowledge and
Yeah.
empowering them through things like self-management, we can see, for lack of a better term, a bleed off of people who are
Yeah.
waiting to go to a clinic. And they're like, hey, you know what? I've got this.
Yeah.
I can,
Yeah.
and I will come back if I need you. So
Absolutely.
even more important than I think anybody, it's definitely for adults, but for children, we just need to do more to help our kids.
Mhm.
Fantastic. And on that, I think that's the perfect way to wrap up today. And just to thank you, Dr. Stinson, for sharing your time and your expertise. And thank you for everything that you're doing for pediatric pain,
Hmm.
not only in Toronto, but across Canada and clearly worldwide. So we just can't thank you enough for that. Our children thank you. and,
Hmm.
and thank you so
Yes.
much.
Thank you both for having me on. I really enjoyed it.
And we'd like to thank all of our listeners for tuning into the Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada as guided by Health Canada's and Action Plan for Pain in Canada. Until next time. Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns. The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.